Hi, everyone. Thank you for coming to Physician Pathways. Today we have Dr. Tanner. He's a dermatology resident here at SLU, and we're just going to be asking him a few questions about how he got into medicine and dermatology and just everything in between. So, Dr. Tanner, thank you so much for joining us today.
Thanks for having me.
Of course. So, to start off, do you think you can tell us a little bit about your training, like where you went to undergrad and medical school, and
Yeah, yeah,
kind of how you got here?
yeah, of course. So I went to Brigham Young University in Utah, had a lot of fun there. And then I did actually my medical school at St. Louis University. And then I did my first year of residency, my intern year back in Washington, because that's where I'm originally from. And with dermatology, there's a few specialties where you can do your intern year separately from the rest of residency. So radiology is like that, PM&R, that's physical medicine and rehabilitation is also like that. So I was able to do my intern year back in Washington, which was great, being close to family. And then now I'm back here for the next 3 years to finish out dermatology residency at St. Louis University.
Awesome. And just off the bat, what should medical students know about the derm residency? And what kind of routines should one expect? And what does your schedule look like? Is there an on-call?
Yeah.
Um,
Yeah, I'll go through kind of just our day to day, I guess. So, generally for dermatology, you'll rotate through a few different areas of dermatology. So, our bread and butter will be general dermatology. And so, when you're on those rotations, and most dermatology residencies are kind of structured in this block format where you rotate through just blocks at a time. There's a few residencies that kind of interleave them. So, you're doing a little bit of general dermatology, surgery, cosmetics, all kind of like mixed in through the week. But St. Louis and a lot of other programs just do it by block. So I'll describe what the blocks are like. So general dermatology is one of the blocks, and you're just pretty much in clinic every day, seeing lots of patients with all sorts of, general skin condition complaints. Then we have a Mohs, so Mohs micrographic surgery. That's one of our subspecialties of dermatology. So you have a Mohs block, and that's where you'll be seeing a lot of the Mohs patients in clinics and performing those procedures. And I won't go into depth about what Mohs is right now, but that's just a surgical subspecialty of dermatology. Then we have cosmetic blocks. So you'll be seeing some general dermatology patients on those blocks, but also seeing a lot of Botox, filler, laser, sclerotherapy patients. We have a peds block, so you'll see more of the pediatric side of dermatology. We have a dermatopathology block, and so a big fundamental area of dermatology is actually, biopsying the skin lesions or rashes and then looking at them under the microscope. So the dermatopathology block is where you'll be with those dermatopathologists looking at the microscopes all day, every day, and reviewing the pathology that you're seeing under the microscopes. And and then we have a consult block. So that's where you'll be doing inpatient hospital consults and seeing more complex or can be complex. Sometimes it's just the primary team doesn't know something that's going on with the skin. Often it can be just very benign, like, psoriasis that the patient has diagnosed for the first time, something like that. So yeah, those are the main blocks that you rotate through. So that's kind of what your schedule is like, is, going through these different blocks.
Okay, sounds great. So you describe like a lot of things that I think us as M2s don't really have exposure to.
Yeah.
Super, super cool. So how as a medical student did you know that you're interested in dermatology? Like, was there like an aha moment, or were you kind of in between a few specialties?
Yeah, so I was definitely in between multiple specialties. I think I came in thinking orthopedic surgery, changed, to radiology, thought about ophthalmology. So I just got a little bit of exposure shadowing dermatology during my M1 year, M2 year. It was during probably M3 year when I rotated in family medicine that I was like, you know what, I really like being in the clinic, and I really like developing relationships with patients and having them be your patients and following them for years and years. So I really liked that kind of setup that I saw in family practice. But family practice was just way too broad for my personality. I really like being much more niche. And I feel like just for my personality, I really enjoy when a patient comes to you and has maybe one or two complaints, and you can just really dive into those rather than having to field. I mean, you'll see when you get into family medicine, patients will come in and you're covering like 10 of their problems. And that bandwidth wise, that was just like overwhelming. And I wanted to be able to just focus on a few problems. So like bridging the two, putting like more focused specialty work together, but then also wanting to have like a patient panel that you follow, that they're your patients. Like dermatology was this perfect mix of the two.
Cool. And so jumping off of that, well, actually, I don't know if you mentioned this, but if you guys have any questions, just feel free to put them in the chat, and we'll also have some time at the end for questions as well. But feel free to like put questions in the chat as they come along. But what I wanted to ask you is, so far, well, what do you love about dermatology, and what is your not so favorite part about the job?
Yeah, so I think the part that I love the most is that you have to love the bread and butter of whatever specialty you're going into. And the bread and butter of dermatology would be full body skin exams, where you're doing kind of like cancer surveillance for people who are at higher risk or have had previous skin cancers. And so you see them back every 6 months or every year to make sure that there's no new lesions that they're developing. So I love the full body skin exam because most of the time your patient comes in, they maybe have had something done in the past, like a biopsy or something like that, and maybe they have a new lesion you can look at. But then the most part, you can just start from like the head and work your way down, just looking all over the body, making sure there's nothing abnormal, and you get to just like chat with them. So unlike some other medical visits where you have to, okay, let's talk about your diabetes now, let's talk about your blood pressure, let's talk about this. It's kind of nice to be like, you know what, we're doing the exam right now. Like we're looking at the pathology, we're looking for it. And in the meantime, we can just say, oh, what do you have later going on today? Oh, you're getting together with some friends to go, for a baby shower. That's great. Like, what's the sex of the baby? So it's really fun to just kind of connect with your patients on that more personal level while still doing your exam and still doing what you're, trained to do and there to give them in terms of a service. So it's the bread and butter of the specialty, and it's my favorite part. My least favorite part would just be the volumes probably that we see in dermatology. So it's probably no secret dermatologists make a good amount of money when you look at them compared to some of the other physicians in the specialty. But what people may not know is that is because we push volume. So whereas in family practice, you might be seeing 20 patients in a full day, in dermatology, you'll be seeing 40. So sometimes things can get really hectic in clinic, especially if you have a more complex patient and now you're running behind. So that would be my least favorite part, is when things get crazy and you start running behind.
That sounds very chaotic. I did not know that. I feel like that's a really like good fact that probably should be spread.
And in private practice, 40 is like average / low. High in private practice is like 50 or 60. So it can get pretty crazy.
Like per day? Like what are the hours then? How does that work out?
I
Or
mean,
like how much time?
Yeah, I've seen places schedule like patients every 10 minutes, sometimes every 7 minutes. So yeah, usually those practices have a lot of extra support. So you'll have like 2 MAs that are like doing, like they're also acting as your scribes and they're rooming the patient. And they might be setting up all the biopsy stuff. Maybe they're numbing the patient, and then you can just come in there and do a quick biopsy. So usually those practices are run very efficiently.
Okay.
But I've also seen a full-time or part-time dermatologist seeing 5 or 6 patients at the VA in a full day, or mostly a full day. So it can still vary. And if you don't like the pace, you can probably find a more relaxed job, usually at the VA.
Gotcha.
Mm-hmm.
Okay, so it sounds like you did some shadowing M2 or M1 and M2 year with dermatology, which kind of set you up really well for knowing what you wanted to do. But looking back, is there anything that you wish you would have known or anything that you wish you would have done differently?
Yeah, I probably just wish I would have known that if I was interested in dermatology, I probably could have jumped on some case reports with residents at St. Louis. Now, I know there's always people who are on our at least at St. Louis, our list for like interest in research and stuff. But there's always little things that come up, maybe not like a full project, but like writing up a case report. We always have interesting patients that come up, and I wish I would have known that. Probably could have like written up a case or two during M1 or M2 year, but it's kind of hard to get in. The clinic's really busy. Usually we have a lot of like third and fourth years, so like just availability to come shadow isn't really an option all the time unless there's some type of elective or something like that, which sometimes we have during M2 year.
Cool. And I mean, kind of going off of that, to me, always like dermatology is this kind of standalone in med school with like, I don't know, it's for me, derm and radiology, because it's really hard to get exposure in like pre-clerkship years if you're not shadowing. And then even in like clerkship, we have like 1 week of career exploration or 2 weeks. So it's just, one of those things. So like, how would you, well, if someone knows that they want to potentially do derm, besides like doing some like shadowing and maybe some research that you talked about, what should we be doing now to prepare to be competitive for the specialty? Kind of what to do with like summers and free time and all of that stuff.
Yeah, I mean, it's a tough one because really, besides like maybe being able to shadow or do a little research, there's not much. And like I would have said, do well on step one, because that used to be a really, kind of a threshold thing or like an important marker, but now that's pass fail. I mean, still do well on step one. Maybe, in between first year and second year, you could do derm research, or you could at least maybe shadow in a local place, because I know a lot of people have that time off. So that would be a good way of getting at least more exposure to the specialty, because it is all about like, especially in third year, fourth year, and residency is all about seeing like case volume in terms of learning. So, being there in the clinic would be a really good way to learn. So that's something I maybe wish I would have done, is like reached out to local dermatology offices, and I bet most of them would have been willing to accept me as a medical student to come in and rotate. But I also wasn't set on dermatology in between my first and second year. So that's probably why I didn't do it.
And then talking about residency, do you think you could explain more about like the application process and everything, and like your experience going through the dermatology residency?
Yeah. So I guess like, it's going to be, I guess like important distinctions for dermatology specifically are that you need to apply to prelim or transitional programs separately from the dermatology programs. So like I said earlier, those are the programs. There's a few programs where it's not categorical. So like general surgery is categorical, where everything's together. Dermatology is not, radiology, those other ones that I mentioned, some of the anesthesia programs. Those ones you need to do intern year like separate. That doesn't mean you need to do it. Like I could have done intern year at St. Louis, but you still need to apply separately. So that's an important distinction when it comes to the actual application program or that part. Other like just tips, I guess, in general for applying to dermatology are like some like derm related like service or like interest is usually good. So like derm related research, derm related most medical schools, including St. Louis, have like a free once a month kind of like dermatology clinic. And we have that. So showing some interest by volunteering there and maybe even being part of like the leadership involved with that can be good. So showing derm related interest is important. Having derm related research is important. But I will say I'm reviewing applications right now for dermatology. And at least my own personal feeling is like just having a super long laundry list of things. Like you'll go on to AMCAT or whatever it's called, and you'll see like the numbers for like, oh, no applicants for dermatology had like this amount of research and it'll be, like 10 or whatever. And like they had all these different work experiences and all these different service-related experiences, and I'm trying to remember what the other category is. It's work research and service, yeah. And just like a little tip, at least from when I'm reviewing these applications, is sometimes, I mean, people are putting their stuff from like undergrad or like high school, just because I can tell by they have to put a date of when they did it. And I'm like not interested in that stuff at all. Like, I don't care. So I used to think that like if they were putting, so this got me really nervous when I was applying. I just want to try and like calm down anybody who's interested in dermatology when they see those numbers, because those numbers are wildly inflated. And I didn't know that until now I'm on the other side and I'm reviewing some of these applications and I'm like, okay, you put down that you were a lifeguard while in like college. Like, nobody cares. And so I thought those work-related experiences when they were showing the average were like derm or like somewhat medical related, but people are just putting down whatever because they think it's better to have more than less on their application. But honestly, like if you have 10 related or 10 work experiences and they're like lifeguarding and just all this non-related stuff, I lose interest. I just start scrolling past it because I'm like, okay, this isn't derm related. I don't care. It's all non-medical anyways. It's not interesting. So my advice then for application is like, don't just put a bunch of like random stuff on there. Like, be intentional with your application, because if you have fewer things, but I will actually probably pay better attention to them and actually read them more rather than just kind of glossing through them. Because I mean, like literally there's some people who have maybe only like 2 work related things, 5 or 6 service things, and then maybe like 3 research things. I'm definitely reading those more than people who have 15 service things, 10 work related things, and then like they have 10 research things, but they're all like not that great. And it kind of just dilutes down. So that would be, I guess, one thing with applications. That would be my advice. And that was something that I had read on an orthopedic surgery blog from advice. So that's something that I adapted while doing my application. And I think it helped, was just like trying to hit your strong points rather than just trying to throw everything on there. I mean, literally people will put like, this one person put like Stop the Bleed, which is like a day seminar thing you do to talk about hemorrhaging. And I'm like, A, this isn't related to dermatology. And then B, like I did that and I did not put that on my application because that was like literally a 1.5 hour thing that I did once during first year, and it's not important, and it just is going to look bad because, so yeah. Okay, I don't want to go into too much more long-winded, but that would, I guess, be some of my advice for applications and that process.
No, that is super helpful, actually. Kind of going off of that, not to dive back into it, but I did have a question. Would you consider anything then important from high school or college? Maybe not high school, but college, like any like research or like maybe
So yeah, if you had like something really big in terms of research that was really cool, like totally. I did things like I was a TA for anatomy in college, but I didn't even put those on there just because I thought like nobody would be interested. So I think the things that I had on there for work, like it was like purely medical related. So like we had anatomy classes that we would teach high schoolers at St. Louis University. So I put that on there because I did that during my first and second year. And I thought it was something like I could talk about, I enjoyed, and it was longitudinal. But I didn't really have that many work-related experiences for that reason. Is just because I wasn't going to put stuff on there from college or way back when. So I would say if it was really impactful, like you can do it. Just be careful by how much you're putting on.
Okay, thank you so much for that. That was really helpful. We don't really hear a lot, I guess, from like the residency application side at this stage, but I think it is really important to keep in mind, kind of moving forward and keeping track of everything. So kind of pivoting, can you tell us a little bit about what life looks like for you outside of medicine, and a little bit about like work-life balance in residency?
Yeah, so dermatology has great work-life balance. Sometimes we get in our own little bubble. As dermatology residents, it's natural to complain. So even little things we'll start complaining about. Like, we're like, oh man, I can't believe I got a page last night at 10 o'clock at night. And, it ended up being something silly, like sometimes like patients will get through the line for like refills or like wanting to schedule an appointment, and I just tell them, okay, I'll send a message to the schedulers. But regardless, like we'll get a page at 10 o'clock at night and be like, oh, this is so frustrating, we totally sound like prima donnas because then I'll go to, I have a good friend of mine who's he's my same year, first year optho resident. And we were hanging out at the gym, and he was just telling me that he had worked all night. He was on call. So he's on call every other weekend, and he's also on call one night during the week. And he said he just got hammered and like didn't sleep at all, had 5 consults that he was doing all night, you know, and their eyeballs, they're important, you know? And so, you know, perspective is sometimes good. Like dermatology, when I hear that and I contrast that with my own experience, like we have a really good work-life balance. So right now, at least, St. Louis for dermatology, as a first year, I take calls 7 weeks out of the year. So in our call, we start at Friday afternoon at 5 p.m. and then we go all the way through until the next Friday morning. So you're on call for a week at a time, but we have a consult. So here, at least at St. Louis, we have a consult resident. So they do any of the calls or any pages that come in during the day. And then you just field things from the evening. So from 5 o'clock at night until the next morning. I've done 2 of my call weeks so far, and so far I haven't had to go in overnight. And I was going to say, I have had to go in during the week, like after hours one time so far. So like during that 5 o'clock and on window. And then I've had to go in on weekends. So even last time I was on call, I had to go in both weekends, so Saturday and Sunday. But they usually weren't really that bad. Oh, did my internet go out? Let me see.
They're frozen for me too, if that's helpful.
Oh, they're frozen for you guys too?
Uh-huh.
Okay. Okay, good to know it's not just me. Well, I can continue talking about call as well. So yeah, call's pretty light for us compared to other specialties.
We're back.
Okay.
SLU Wi-Fi never
Wi-Fi.
changes.
Yeah, definitely.
And
And then, yeah,
sorry.
so most of the time, like I'll just go over a general schedule. Usually we have a morning lecture from 7:30 to like 8:20, and then we do clinics from 8:20 until about like 4:30ish, and then you're finishing up notes until like 5:30, 6. It just kind of depends. Sometimes, you know, we have bad days, and you know, you're doing notes until 7. But overall, it's not that bad because the schedule is just very consistent.
Yeah, well, I actually wanted to circle back to something you said earlier about like you really appreciated like talking to patients and having that connection with them in long term. And then you also mentioned some procedures like biopsy. So like, what would you say are some skill sets or like personal characteristics that are really valuable in dermatology?
Yeah, like having fair amount of hands-on skills. I mean, you're not going to be a general surgeon, but we do a good amount of surgery. Even if you're not a subspecialist in dermatology, like a Mohs surgeon who does surgery like every day, you know, as the physician at wherever you work, you're going to be doing excisions. So you're going to be excising, you know, basal cell and squamous cell carcinomas on the body. So there's certain areas that go to Mohs. So those are like the face, the hands, the shins, the genitals, ears, sometimes like the neck, the feet. So those areas go to Mohs. But if somebody has like a basal cell on their back, like you're the one who will or should be trained and should take care of that. So, you know, you'll be doing excisions of cancers, you'll be doing excisions of cysts. You know, there's pilar cysts, there's epidermal inclusion cysts. So having some good surgical skills is good. And, you know, you will definitely get those skills while in residency. One of the things that, you know, I really liked procedures, but I felt like in medical school, you just didn't get as much hands-on training just because everyone's busy. And even on your surgery residency, you know, they're like, okay, medical student, come in and help close the skin, but you're so slow and timid. And so you're closing up one port site. And by the time you're done with that port site, they've closed up all the others. So you get like a tiny little bit of suturing practice. But between your intern year, usually in the ED, you'll do a lot of laceration repairs. And then as soon as you get into dermatology residency, you start getting tons of experience. So like when I was on my Mohs surgery rotation, yeah, I was immediately suturing up, people's necks, faces. We have resident surgery clinics where you're the one planning the surgery and, doing everything. So already, I feel very comfortable and like feel like my surgery skills have improved greatly. So that hands-on skills are important to have. Just being able to kind of like quickly move through information, like see the patient's chart, see what they've been here for previously, and then just like go in and see the patient, extract the information quickly, maybe even while you're doing the exam, just because derm clinics are fast-paced. So you just need to be able to, absorb the information quickly and just like move on. But that is also just practice. Once you've seen the patterns in dermatology enough, you get faster and faster. So because I am someone who generally likes to be more thorough, but just over time, you can just move through the information faster. So I wouldn't tell people who feel like they need all this time to really sit down and absorb that they should shy away from dermatology, because you'll get faster with practice.
Seems like a general piece of advice too for like everything, as we're like going to like a suture clinic and they're like, oh, you get faster. I feel like everything gets easier with just practice and muscle memory, but that is very helpful. At this time, we'd like to open up to questions. If anyone, you can either unmute or just put it in the chat. But we wanted to give at least a couple minutes for that. If not, that is okay too.
I have a question. Oh, sorry.
Go ahead.
Hi. I was just wondering, for the current M2s who are about to start clerkships in February, I guess not about, but it feels like it's closer than that is. Do you have any advice, since there isn't a lot of exposure to derm specific things besides the elective weeks, just things you can kind of actively work on, or like during clerkships, or ways to get a little extra exposure to derm if possible?
Yeah. It's just so tough. Definitely come to like our free clinics that we have once a month. And the derm interest group people should be able to like reach out with those. And then like, if you want, like shoot me an email, because it's hard during third year because you're so busy. But if there's like Thursdays that you're available and I'm on resident clinic, feel free to come shadow. You'll still get to see cool pathology. Today, even my resident clinic, I saw a guy with fixed drug eruption, which is kind of cool pathology. And, especially because it's just one of those fun moments in dermatology where I remember getting a message from his PCP being like, hey, this is a really weird rash this guy has. I don't know, if it's psoriasis or this or that. And then, immediately walking in, seeing the lesion, talking to him a little bit about it, it was like, oh yeah, this is 100% fixed drug. Don't even need to do a biopsy. So we still see some cool pathologies. This other guy also, actually, that I saw today in clinic might have fixed drug eruption or something else, or a combination of two. So yeah, if you want, just send me an email and we can see if there's like times to work in. You won't really get much FaceTime with like the attendings, but at least you'll be able to maybe meet some of the other residents, and then you'll be able to maybe see some cool pathologies and see what we do at dermatology.
Awesome. Thank you.
Mm-hmm.
Hi, Dr. Tanner. So I've had a little bit of time now this semester to like get exposed to dermatology, and I really do like it. But the biggest thing that's holding me back is like looking at like those data reports from like the match and seeing like those really scary looking numbers. Like I think they say like for match derm residents, it's like you have like 20 research like papers, abstracts, publications, all that. So like how focused was your application in like research, or was it like very derm specific research, or did you just have like a lot of general stuff like to build yourself?
So I had like more derm stuff. You get a lot more like during your third and fourth year generally, because and like you can get stuff during your first and second year too. Like, but I had maybe one tiny thing from first year. Like I was involved in the dermatology interest group and I helped out with some surveys. So I buried that. That was like a low thing that I did, because that didn't really amount to much. I didn't have like, I mean, I can go over application stuff too, if that's helpful for people, like my own personal application. So I had like, I think 7 or 6, or no, I think I had like 4, maybe like research experiences. People kind of list these. I mean, you'll be able to see in your application, like everyone does it kind of differently. So I listed as research experiences things that were very like longitudinal. So things that I'd worked on for a few months. I didn't list a research experience being like a case report I wrote up, because I just listed that under like the publications, or there's like a section for your application that's submitted. So I think like I ended up having like 2 case reports that I submitted. I was on like a double randomized controlled trial, like double blinded. So that was like my bigger one that we had submitted as well. Or I don't know if we actually had submitted it. I think we were working on it at the time. But so I had like those 3 were derm. I had like a small derm thing. I had like, in terms of like the section where you list all your poster presentations and publications and whatnot, I had like something I'd done that was like related to hearts and like heart valves in between first and second year, that ended up turning into like abstract and poster. And so those ended up, and it got presented like twice, and so that ended up being like 3 right there. And then my derm stuff probably put me to like 7. So if in that section where it talks about like published whatnot research, like I think I only had like maybe 7 things, maybe 8, like maybe there's something I'm missing. And some of them were duplicates, right? Like something that was an abstract that we presented twice. So not like a ton. And then in my like actual research, like the longitudinal side, I think I probably only had 4 or 5 like things listed there. So I was probably on the lighter side. I didn't do a research year, but that's because by the time I was like committed to derm, I just was like, it's derm or bust. So if I don't match this year, I was already planning on trying to go into do a research year. Whether it's like, so St. Louis has a research year where you graduate from medical school, you do your intern year, and then you come back and you do 2 years of research fellowship, and then you can probably match with their program. So I was already like, that was one of my plans, or like delay graduation, do a research year, and then reapply was another one. So, and then like in terms of my other things, I think I had listed like maybe 7 or maybe 6 or 8. I can't remember exactly, like community service things. And then, like I said, I probably only had like 2 or 3 work related things. Overall, so I applied in the middle of COVID, so things were really crazy, but I got 8 interviews. And they were at Iowa. I got at University of Iowa, Vanderbilt, University of Missouri, St. Louis. I got one at LA Kaiser, and Virginia Commonwealth University, Virginia Tech, and where was the last one? Oh, Tulane. And the Tulane one, I think I got just because, so a lot of this will be kind of like who you know and whatnot. So Tulane, I think I got because I've actually forgot. I did this like joint research project with people from different medical schools. And the person who was in charge of that was a dermatologist at Tulane. And that one, so this is the thing where sometimes you'll get research opportunities. Like I was in my 4th year, I was on my dermatology rotation, and they were just looking for another medical student. And so I was working with one of the doctors, one of our attendings, and she was just like, hey, I need a medical student for this like joint project. Are you interested? And I was like, yeah, sure. So while you're on rotation, 3rd year, 4th year, like you can potentially, talk to the doctors, see if they have research opportunities. So like us residents, we always have research opportunities because we're completing projects. So like as a first year, I partner up with a 2nd year and 3rd year, and I work on 2 of their projects with them. So that means, there's always like there's the 4 3rd years and 4 2nd years working on projects as part of the ACGME requirements every year. So there's 8 projects going on in dermatology. every year. So that means there's always plenty of, projects for third years. And usually that's like, third years, fourth years who are interested kind of get on a lot of those projects. It's good to get on it third year though, or second year. I mean, we're looking for second years too, because second years especially, they have more time to come in, second or first years, they have more time to come in and help out in clinic. And those projects usually, so like we've just started submitting the IRBs for those projects. So usually like around like, making sure you're on our research list of like interested medical students, and we can review your CVs and stuff, and then like pick students that we, want to work on the projects. And those projects, like putting you on the IRB, getting that process rolling happens in like September and October of every year. So just something to be aware of. So I think like a lot of the projects this year already have medical students on them. There's maybe some projects still that have need. You can reach out to our research coordinators. I don't know their emails off the top of my head, but if somebody wants, I can email whoever organized it their emails, and then you can just email your CVs to them and ask to be put on the dermatology like research list of interested medical students. What other things? I would just say like definitely like getting good grades in terms of your like clerkships are important. That's generally one of the things that are looked at is like honors, near honors. Like obviously getting like near honors isn't the end of the world. I think like we had 6 rotations. I think I honored 5 and near honored 1. So it wasn't like I had a perfect record, or maybe I near honored 2 and honored 4. So that was fine. I did have a really good like step 1 score, and they used that at the time. So, that's probably important to have a good step 2 score. Do people have other questions about applications? I'm willing to be, very transparent.
I actually had a question regarding some of the application related things. It's actually going off of research, and I was wondering your opinion on, like, for example, just the gap year in general. Like, I know you mentioned briefly about that of how you didn't take it, but I was wondering specifically during gap year, would you rather have applicants work on several clinical projects that usually leads to, or like publications, abstracts, etc., or a wet lab type of like scientific dermatology research, which would be relatively slower than the clinicals, but instead be more impactful in terms of paper, I guess.
Yeah, that one's hard. Like, I think like the clinical might be better, especially if you're able, like, because wet lab takes so much time. Clinical, you could potentially be on like multiple projects, which means you get to know multiple attendings. And that's like one of the big reasons you do research. Like people think like, oh, research is, important just because, I mean, it does check a box and it does show your interest, and you really do learn a lot during research. So that's like good as well. But it's really the network and the connections and the personal relationship you get to develop with the attendings. So like, I think, that was a huge benefit. Like I said, the double-blinded, like randomized control study that I was on was like instrumental in me developing a really good relationship with the attending dermatologist that was on the project. Because it was like pretty much just like me and her, and there was like a research fellow, one of the St. Louis research fellows was also on the project, but I worked on this project with her for over a year. So that's like just one of the most important things is, she probably could, I mean, I don't know what kind of letter she wrote me, but I would imagine she was able to write me like a better, maybe more personal letter. She was probably able to speak to me about like my work ethic in terms of research and responsiveness, my enthusiasm for dermatology. So I kind of would lean towards the clinical side just because you would develop those relationships more likely.
Thank you so much.
Mm-hmm.
Thank you guys for asking questions. This was all super helpful. Thank you so much, Dr. Tanner,
Yeah.
for your time. I know you're super busy and juggling a million things right now, like 5 million patients per day.
No,
So
that's wonderful.
thank you so much for your help and for your advice. But I think we can definitely wrap it up now. And then if you guys have any more questions, feel free to shoot like us an email or I think the coordinators too. We can.
Yeah. Yeah. And if, you know, anybody can feel free to email me too. I might just take a little bit longer to respond, but you know, open book, I'll let you know anything you want to know. So just, you know, want anybody who's interested in dermatology to have, you know, all the information and to, it's a great specialty. So want everybody to have their best shot.
Thank you so
Cool,
much.
thank you.
All right.